Hello. I'm just saying what we're doing with most of our COVID patients, although as I say, I'm working in a trauma unit, not a COVID unit, so I don't have COVID patients constantly. But primarily we changed from early intubation to trying not to intubate because outcomes are better if we don't have to intubate. So we are doing things like more deep breathing, coughing exercises, encouraging patients to prone themselves, which is literally just lie on your stomach periodically if they're feeling short of breath. We are using non-invasive ventilatory supports, which are like something that we call OptiFlow, which is high flow oxygen through the nose, or BiPAP, which is a tight mask, which helps support your ventilation without an actual tube. We are, when intubation is necessary, other than all the usual supportive care things that we would do, we usually give steroids. And we move fairly quickly to, again, proning patients, which when they're ventilated is a much more involved process. We have even sent a few patients, because we don't do ECMO, which is sort of an externalized lung. It's a very complicated and resource intensive thing to do for people. But if we cannot oxygenate them, sometimes that is something that we send patients to another facility to do. We are not using a lot of other COVID-specific drugs at this point. They'll often be on antibiotics so they don't get a superimposed bacterial infection, but we're not giving things like hydroxychloroquine. We might give zinc or some of those other things.
What antibiotics would you routinely use on these patients?
Well, it depends, because we'd often be looking at, if we're looking at a lung infection, a bladder infection, what other
Just
kind of
what you've seen.
Piptazo, so a kind of combined piperacillin tazocin drug we would use often. Ceftriaxone, ceftazidime. Sometimes we're heading into things like meropenem or ertapenem if we're isolating other things. Azithromycin. Sometimes we're using azithromycin, not that much.
Not that much. Again, a lot of people are touting that as a miracle cure.
Well, sometimes we're giving azithro.
Does it cure them? Not really. They're that sick of that.
I wouldn't say I can tell you one thing that cures them, because unfortunately if you get patients that are sick enough to be ventilated in ICU, they start to have a cascade of problems. Yeah. So there's never one.
So to claim this particular drug prevents and protects people from COVID, you're not seeing anything that could even be claiming that?
No. Well, no. I mean, usually if I'm seeing someone with COVID, it's because they're quite sick. So certainly dialysis is still something that often factors into play. And all of the other things that are just supportive care, which we would do with anyone else. Any patient who has a septic kind of infection.
What do you estimate your COVID death rate is in your unit?
It's very hard to say.
Yes. I mean, it's not science, it's not a sample, it's a convenient sample of a few people in your ICU. The COVID positive ones, how many approximately live to get off the unit? Percentage, just roughly.
It's really hard to say. I've had COVID patients that have had brain bleeds. So what do I say is the reason that
all of the COVID?
They died?
No. I'm talking about, like, out of anybody labelled COVID positive who ends up in your unit, approximately what percentage do you think actually will get out of your unit? That doesn't mean they live, but actually gets out of your unit.
Oh well, 70%.
Get out
to a different unit.
Right.
Possibly.
How does that compare to anybody else in your unit?
It's not that dissimilar.
It's not that dissimilar. They're sick and
they're all sick to be in my unit. I would say the traumas have a higher percentage that get out.
Spines and heads,
yeah. They are more likely to get out of our unit than someone with a septic kind of picture.
Right. So it's more of a medical response to COVID, right, than you would traditionally see with the trauma. Oh, are you seeing more or less? This is December the 10th.
More.
How many more? One more a shift? One more a week?
I think the feeling I'm getting is that the hospital is seeing quite a bit more.
No, what are you seeing in your unit, right?
Well, it's more.
Yeah. So enough to notice it, right? Yeah. And that's despite having a dedicated ventilatory COVID unit elsewhere.
Yeah.
We were almost always full. So that's why you're getting them now.
Yeah.
Right.
Yeah.
All right. Anything else you'd like to add?
No.
All right. Say goodbye.
Bye.
Toodles. This is a Cats on a Snowy Day production, 2020.